Okay, back to the concept of Medicare for all, or also called universal health care. I've delved into a couple of videos of why I don't find it to be health care. But this one is going to be discussing why and what I want to see as the disease management system. Okay. I want to see a government-regulated sliding scale fee, which is to say, pay what you could afford. For those people who can't afford a dime, they shouldn't pay a dime. But the government, therefore, would pick up the rest of that in terms of the part of it that would be fee for service. Okay? And then combine that with a monetary benefit based upon best outcomes for people with diseases, for overall patient care. This way, you would be able to, on the one hand, you wouldn't be penalizing people for showing up when they really do need assistance, nor doctors. But on the other hand, you would not be requesting and giving more money for doctors who either constantly mess up deliberately in terms of actually creating mistakes in terms of repeated surgeries in terms of surgeons, or the far more common phenomenon of doctors giving a treatment that, for the most part, in the long run, it is going to hurt the patient. It is going to create some significant side effects and likely lead to an earlier grave. But that'll take between 20 and 50 years for that to happen. Minimum of 5 before any real damage occurs. But nonetheless, it is actually hurting them. And in the meantime, it is keeping them a steady patient by making them show up for lab work when otherwise they wouldn't need to. And other testing, again, which otherwise they wouldn't need to. So, that's why I'm not in favor of Medicare for all. If it's a penalty, and again, I view it as a penalty in this construct, for us getting past across this country universal basic income, then I'll accept it. I won't really like it. I'll never really, again, try and help people fight for it, because Medicaid works better than Medicare. Medicaid works better than Medicare. And, which is to say the hybrid works better than the pure government run. And because it has more doctors and it has more choices, okay? Simply put, Medicare across this country, not many physicians, practitioners actually accept it. And therefore, the few people that do, you're left in long lines in terms of months and months of wait times. And then once you get to the doctor's office, between best 1 to 2 hours of wait time, most of the time 2 to 4, sometimes 6 hours at a stretch of just waiting to see a doctor. I've had to wait as long as 9 hours myself to see my doctor. So, and that was after spending about 2 hours in transit on the way there, and then about 2.5, 3 hours on the way back. So that was a huge thing, because I was just going there for a checkup. In the end, the ordeal, not being able to really afford on-the-go food, I couldn't move for about a day or two afterwards from the exhaustion factor. So, again, I'm not. By the way, for people who, again, I've seen the construct of, and it seems like it's a guttural reaction. you don't want Medicare for all, so you want insurance companies to profit more. No. And, oh, by the way, I'm not saying that Medicare for all, if it's passed, is going to be a quote-unquote complete disaster. I'm just saying that it's not really going to help all that many people all that much. Most people that I see are pushing it as this, like, cure-all. This is going to solve all the problems of health insurance and of healthcare in this country. It's not. It might make things 2 to 3% better for some people, maybe even for a sizable number of people. But it's not, it's not utopia. It's not, again, it's really not going to help many people all that much. I have it. I have Medicare right now. I pay I get what I need in terms of, because I don't want to wait years and in the end and go back and forth to different visits and follow the rigmarole of specialists. So, and I get what I need in general from Amazon in terms of joint braces. My painkiller is turmeric and black pepper. So again, I either, just as with the joint braces, I either get that in drugstores and or online. So it's, and again, I have chronic medical needs, and I am disabled. But Medicare doesn't really help me at all. Medicaid, when I had that for a while, that was alright to some extent, but again, with the massive amount of bureaucracy involved in terms of all the rules, all the procedures, and the fact that Medicaid was a lot better in terms of how many doctors were covered, but it still had severe caps on the number of physical therapy visits. It still had caps on the way that they could do it in terms of one body part per time. It has a whole lot of problems. It doesn't cover acupuncture, which otherwise I would use for as a pain management. As it is, I use the stopgap. It's similar to acupuncture. It's acupressure. I use a mat, and I bought that. Again, but it's not the same effect as acupuncture for pain. So as with all things that I talk about, I ask people to please be realistic. Please think, please. And again, if you want to ask me or other people what they have to go through, please ask us. Especially me, I'm an open book. I think most people that have really been following me, either here or on Facebook or I'm not on Facebook anymore. I haven't been for a year, but on Twitter or on MeWe, I'm an open book. I don't mind answering questions. If you're reasonably respectful, yeah, tell me what you want to know. But stop ignoring folks like myself who are identifying the real and legitimate concerns. Again, I'm not saying at all that Medicare for all or universal health care is going to kill off massive numbers of people. No. I'm just saying it's not, might help a few people a bit, but before the expansion of these health insurance companies, doctors and medical practitioners used to often have signs about the sliding scale fee that they were offer. All you needed to do was, say, I can't afford this. What's your fee scale in terms of for people like myself who really can't afford it? And they give it to you, and it would be a pre-made form. They had copies of it. You might have had to prove, your income level. Like in some cases, it said, if you show us your Medicaid, your food stamp card, then we'll give us a public assistance award letter, something like that. They'll gladly work with you, but At this point, you don't see that anymore. And that's why, in efforts legitimately made and pure intentioned, especially by the populace who's asking for these changes, in efforts to try and help more people, I really think that in a sizable number of instances, people have been hurt more by it. So, think, question, read, listen, and try to open yourself. Again, I really wish that Medicare for all, I could just say, yeah, let's do it. I can't. I know better. I wish I didn't. Shalom.